I was told I had 7 minutes. I don't know, I'm going to try and do it in 7 minutes. I'm Iyamide Thomas of the Sickle Cell Society. We're a national voluntary organization based in London, but we serve the UK. And my talk is going to be slightly different because I'll talk a bit about newborn screening, but we have Lola Oni on the panel who's more familiar with the practicalities of it. But I am going to talk about how the society lobbied for screening and how we actually work with the screening program. Because the NHS engagement lead, the NHS actually stands for me leading on the project we have with the sickle cell, sorry, with this screening program, yeah? So my first slide, right, I'll just go through that. There are approximately 15,000 people in the UK with sickle cell and 380,000 are thought to be carriers. So in 2001, there was a successful lobby which involved the patient organizations, various stakeholders, and the society was quite involved in that. I wasn't at the society then, but I got some historical information from the director who's one of our past directors. And they lobbied for the world's first linked program of antenatal and newborn screening for sickle cell disease and thalassaemia. There is not a newborn screening program for thalassaemia yet, but there is an antenatal screening for thalassaemia in England. Yeah. So this was the people that lobbied. We had a lot of patrons in the society. You might know Paul Boateng. He's a Lord now, but then he was an MP and he was a cabinet minister. So he was right there at number 10. Florence Benjamin used to be on television. Trevor Phillips, the Reverend John Santamu, who was former Archbishop of York, who's a Lord now. At the time, this is only in 2001, Sir Liam Donaldson was the chief medical officer, and he helped the lobby at the World Health Organization as well. There was also Baroness Howell, late Baroness Howell, who was part of the lobby, and of course the Society's Board of Trustees and other stakeholders, where it was really good to have people who are key people who are known out there in the community. That's not to say there wasn't screening. There were testing, you know, in high risk areas, but they wanted a screening program. So in 2000, the NHS plan, there was a one-liner after all that lobbying, which was included, and that was when Frank Dobson was MP, was the Secretary of State for Health. And this is the one-liner that I've put here. There'll be effective and appropriate screening programs for women and children, including a new national linked antenatal and neonatal screening program for hemoglobin of sickle cell disease. So the UK actually has a world first in that they link antenatal screening, that is screening, you know, couples at risk with the birth of their baby, and there's a linked program. So when a couple is at risk, they then follow them through. There's a screening pathway. And you know they can predict, you know, 2 carriers have a 25% chance of having a baby with sickle cell, etc., and follow up there. These were some of the advocates. You might recognize John Santamu. This was at a World Sickle Cell Day event we had with the screening program. That's Dr. Alison Stritley, who became the director of the screening program. She was quite an advocate, and one of the pertinent lines she was always saying when she was working for the screening program, she's moved on, was you screen to care. So that was a mantra they had. You don't screen to just find out that the baby has sickle cell and leave them. You screen to care so that you put in all the prophylactic treatment like penicillin that was previously mentioned, folic acid, all that sort of thing. So this was the antenatal screening program to detect carriers of the hemoglobinopathies, identify at risk couples, and through that there's informed choice. You screen to give people enough information for them to make a choice as to what they want to do if they're newborn, you know, before they go on to the newborn screening. In the antenatal screening, at risk couples are offered prenatal diagnosis. You know, if their baby is affected, they will know beforehand and make an informed choice, etc. That is what screening is for. You don't screen to tell people what to do. Of course, the newborn screening then identifies babies with sickle cell and all the other sort of major hemoglobin disorders. And then you can put in the treatment. A byproduct, of course, is if the baby is a trait, that's detected as well. And also in some cases, this is how the father knows their carrier, because when the mother is screened, if she doesn't carry the sickle cell gene, they do not call the father to get tested. But if the baby is born with the gene, then it's obvious it has come from the father. So we've had cases where fathers only find out that they carry the trait when their baby has been born. And there's sometimes been a lot of interesting discussion around that. So just to repeat again, why do we screen? We screen you during pregnancy to give parents a choice about what to do, the risk to their baby. It's important. I just mentioned about the fathers finding out. When the baby is born, the newborn screening program in England actually also screens up to age 12 months. It's not just newborn, especially for people who move in, movers, they're always keen to catch movers. So Lola might be able to go more into that, but it's not just the baby. If movers come in, they can be part of the screening program up to 12 months. You put education in place, everything like that. And also at other times, it helps people to plan their family. Even though there isn't a preconception screening program, it's the awareness that we raise actually makes people, you can go to your GP, especially if your family has sickle cell or the gene, and get tested before pregnancy. So I'll just go over the mission of the screening program in England. It's to support informed choice. It's to improve infant health and identify those babies quickly, provide accessible care, and I'll go into that as to how their standards for that care, and to promote greater understanding and awareness of the condition and the value of screening. And I'll tell you how that was done through us. They started, phased it in. It was region by region. Public health and commissioning was involved, so it worked across various disciplines. The screening program has standards, such as timeliness of newborn results. The results for newborn screening should be given within 28 days, but I'm pretty sure it's done earlier. But the standard is it should be done within 28 days. And follow-up of any affected baby should be within 3 months. Follow-up, for them to see a pediatrician. These standards, they're key performance indicators, and they show you how the different regions are performing, basically. So we know where to sort of target improvement, and they're published. They're open knowledge, they're published data, and you can see how the regions are doing, and that's on the gov.uk website. The screening program publishes the data. Last June, I don't know if you knew, but I get the Public Health England blog, and surprisingly, it came at that the 28th of June has now been declared International Newborn Screening Day. So that's a new date to add to the 19th June World Sickle Cell Day. And what we did, we helped advertise it, and we did a graphic. This is actually a graphic we did and shared around, talking about the screening program, how it's done. These are the latest results that I mentioned, on gov.uk. They're usually sort of a year, behind. And that year, 626,000 newborn babies were screened for sickle cell. That gives you how many were tested with the trait. There, 1 in 79. Approximately 300 babies were born with the condition. And that's just to tell people the chance of them having a baby with sickle cell. Right, the newborn screening program in UK, the sickle cell and thalassaemia screening program, both antenatal and newborn, is very unique in that they work collaboratively with the patient organizations, both with us and the Thalassaemia Society. And that's because we form the sort of interface between them and the service users, and we can help them address any inequalities, and we're doing that. And I'll show you how some of the work we've done with them. This is how we've collaborated in the past, and even presently. There was a massive public outreach program where we used a DVD to go out to the community. It was a family legacy DVD. I'm sure some of you have heard about it. It's on our website if you haven't seen it. and it was really quite a successful program, and the government.uk website has it to show other people how you can outreach to Black and ethnic minority communities in particular. Service user engagement, we do focus groups, and we have to find out, I'll explain one of the focus groups we're studying, currently doing. Advisory groups, we find service users to be on screening advisory groups. We've done a lot of media with them. We've done past research. We've helped with the awareness of the newborn outcome system, which is a system that maps the path of the baby once they're in the screening process, and it's shared with around the screening centers. This is the awareness of the National Hemoglobinopathy Register, to tell people that please go on the register, and the use of the data, why it's important to have your data on the National Hemoglobinopathy Register, and we raise awareness of penicillin immunization. We've also, in the current commission, produced 2 publications, and this is under the screening program, and obviously it will help newborn babies that are affected by sickle cell. These are on the Society website. It was a parent's handbook. The Society managed the editorial team that was made up of clinicians to produce the parent's handbook. Lola only was on that editorial team as well. Pediatric standards, we had that's new pediatric standards again, to show how you can manage children with the condition. I mentioned the focus group earlier. We're currently doing a focus group on behalf of the screening program, both ourselves and the UK Thalassaemia Society. We're speaking to parents who have had a child with either trait or sickle cell who's under 3, to find out their feedback on how newborn screening results were communicated to them. So we've had one was with mothers. I think I had one with 10 mothers in July, and we're now planning to have one with the dads. They're a bit more difficult to recruit, and we're also going to have one with people who are trait preconception. They haven't had a baby yet, but we want to discuss that. So please, if you know anybody that wants to take part in that, contact me. My email is down there, and they can take part in the focus groups that are being planned for the next few weeks. Yeah. Right. I thought I'd show you some of the outreach done on behalf of the screening program with the Family Legacy DVD. I did show the DVD in barbershops, got the men to wear the screening bags. They were all very keen. And, that's men in bags. And this one, hands in bags. We gave them food. Their hands are in Kentucky Fried Chicken bags, by the way. And that's me just, telling them about sickle cell after showing the film. For those that don't know, the Sickle Cell Society, these are the services we offer. We have a helpline, education talks, newsletter, Facebook, all sorts of things. We do outreach. Well, that stopped because of COVID. We have an all-party parliamentary group for sickle cell. We collaborated in research, and we've done employment, education. We're currently possibly going to do one on welfare. I think the next research project is. Campaigns, we do have a blood donation campaign. More Black people should give blood. So please contribute to that. Everything's on our website. I've mentioned the screening program. We have a respite for parents. We have children's holiday, other activities. All that's gone online, and a mentoring program, which we hope to restart soon. And that's how you can contact the helpline. We're based in Harlesden. We're on social media, so do get in touch. That's me. I don't know whether that was 7 minutes, but let me stop sharing.
That was, I'm still on. That was super. And again, I'd be delighted to hear the results of your focus group, because that's precisely the question that I want to know the answer to. How do I communicate with the people who've got the condition?
Yeah,
absolutely do.
Yeah, we'll probably have them. It won't be now till the end of the year, I imagine, but we plan to do some sort of publication around that. But until that comes out, I should have mentioned that in about 2 years ago, we did do interviews with women who've been through the antenatal screening program. And even though they mentioned some of what, their results for newborn, and that's called Parent Stories. So if you go onto the Sickle Cell Society website, we do have a publication called Parent Stories, and it does mention, it's interviewing women who've been through the screening program, and, some of them spoke about the newborn screening results being given late. One thing that came out of that was this whole thing about one or two health professionals saying no news is good news, and then the baby ending up with sickle cell. I'm not saying it's bad news, but you don't tell people that no news is good news. That happened then, and in one of the focus groups I did recently, it's still happening. So we really have to cut that, and let the health visitors and whoever gives the results know that's a no-no.
Yes, I totally agree with that. Just if you know nothing, say nothing.
Yeah.
It's always better.